I was asked by a subscriber several weeks ago to talk about addiction in relationships because we know that when you're having an affair, there is an addictive component, and that actually is what keeps it going, what makes it continue with the anxiety and depression. But can you be addicted in just a normal relationship where you're both being monogamous with each other? And the answer to that is yes, you can. You've seen it in the beginning. You may have even felt it. There's an overwhelming lust or just desire to be together. You want to be together all the time, and that's normal in love. Sometimes that infatuation can turn into like an obsession. You talk to everybody all the time about this person. And then something interesting happens in some people's brains, whereas they start feeling unhappy, they start feeling alone if they're without this person. So this person is actually moving in as a vice to help buffer them, to make them feel better, to make them feel happier, to make them find meaning and joy in life. And when that happens, it takes a drastic turn because all of a sudden, as you can imagine, the person who is addicted to the other one is feeling really vulnerable. Like, if I lose this relationship, then who am I? What am I? Can I go on? And the more they start feeling that way and talking to themselves that way, the more likely their behaviors are becoming more clingy, more suspicious maybe, and more feeling like they're totally dependent upon the relationship, upon the other partner. And this pressure many times can make the other partner feel so overwhelmed that they don't think they can fulfill their part. They feel like, I just haven't been in a relationship like this where my partner is really loving. I don't know what's real. I just feel totally overwhelmed. So how do you know if you are addicted in a relationship? There are some signs. And if you've had a couple of these signs at a minimal level, it may just be the beginning stage of a relationship. It hasn't deepened yet. But if you're feeling these all the time, consistently, then it's more likely, it's a pink flag, that you may want to go for further counseling so you get that insight you need. The first of these is feeling panic when you're not together, denying red flags in the other person, making excuses for them. You start seeing things, your friends tell you things about this partner, but you're totally blinded because your need for them, your addiction to them, is stronger than what other people close to you are saying. Feeling unworthy or feeling unloved if you don't get reassurance from this person, if this person doesn't seem like they want to be around you. You start acting impulsively. You start doing things outrageously different than what you used to do. People will even say, "Are you okay? Like, why would you take this risk?" I've seen people who will take risks, go places, try new things just to please this other person, because that's how strong the addiction is for this other person to care about them. You may start like acting erratically because the feeling that you're having for this person, even minimal conversation about maybe dislikes, or when you have any kind of conflict at all, you go overboard. You take it so deeply. And this is where many times my clients will say, "Well, my partner keeps saying I'm overly sensitive." Perhaps it's oversensitivity due to a feeling that you're losing the person. You're feeling that panic. You're feeling that intense loneliness. This usually does not happen to people who were raised in a family that had a mom and dad who showed healthy attachment style, who were there for each other and there for the kids. However, if you were raised with abusive parents, maybe a single parent, maybe a chaotic family, there were a lot of kids, there was a lot of problems going on, a financial distress family, these kinds of parent figures actually could enhance you to be more likely to addict to a partner, especially if one of your parents had an addiction. It doesn't have to be a relationship addiction. It can be an addiction to alcohol, an addiction to drug, anything where the vice was calling the shots. They were no longer aware or able to say, no, this is family and this is the drug talking or the vice talking. In other words, they went totally into it. When that happens, not only are you seeing that modeled for you, but you may have a genetic component that could contribute to that. So what should you do if you want this relationship to work, or even if the relationship is already over, but you feel like you have this? Honestly, therapy in this case is probably the only thing you can do, because a therapist is going to help hold you accountable. Because remember, there's going to be a time where you're craving. Just like any addiction, you're going to crave getting in touch with that person, doing something to get reassurance from that. And having a therapist is going to be a good person, an objective party. They will give you things to do during that craving, such as ways to calm you, ways to self-soothe, which you may not have had. And even if you have, when you experience one of these cravings that is comparable to a cocaine craving or anything else that a person could get addicted to, you're going to want that person's assurance, that person's love, that person's affection. And when you constantly need that, it's overwhelming the relationship. It's putting all the stress on the other partner. So here's why therapy is so important. Number one, you've got a professional you can talk to, and they can validate that this is an addiction and this is how we treat addictions. Doesn't mean you need to break up with the person, but you do need to break up with your need, your craving, your impulsivity to get that reassurance from the person. Therapy can also help you manage unresolved stuff in your family of origin or your past. There's something that is fueling this addiction in this relationship, and usually it stems from underlying unresolved family issues or young adulthood issues. Therapy can also offer couples therapy, which is really a good idea if the two of you are really close, you want this relationship to work, and you're thinking of a future together. Then I would say go as a couple, go as an individual, ask that therapist to help you find a couples therapist, and then at that point join a couples therapist so the two of you can go together. It's going to be much better because you'll know exactly what triggers the cravings, and your partner will know what to do and what to stay away from, which is really exciting and helpful when you're working through this. And lastly, I think it's so important to get therapy, because whenever you have an objective person like this, that person can hold you accountable, and you need to be held accountable by someone other than your partner. When you put that pressure on your partner, it's too much, and it basically imbalances the relationship, and you don't want that. If this video is helpful for you, please subscribe. And if you're already a subscriber, thank you so much.